I would love to bring on our CarePatrol team here to uh, introduce them before we kick off our program and learn a little bit more about CarePatrol and the wonderful professionals behind the scenes offering this service. So Charles, wow, you're in my center square there, and I believe
Perfect.
you are the one who's going to be talking about telling our audience a little bit about what CarePatrol does.
I will make the introductions. Good afternoon, everyone, and welcome to the latest presentation in the CarePatrol education series. My name is Charles Picard. I am the CarePatrol franchisee serving Prince George's County, and I also work in the District of Columbia and Charles County. For those of you who are unfamiliar with CarePatrol, CarePatrol is a nationwide senior care placement organization whose mission is to help seniors and their families find the most appropriate long-term care living options. These include independent living, memory care, skilled nursing facilities, but most often we are working with assisted living facilities. What CarePatrol does that makes us different is that we offer a personal service, providing guidance throughout the entire process of locating the right senior living option. From finding out about your loved one's specific healthcare needs, to accompanying families on the tours of recommended facilities, right up until the actual day of admission, we are there with you every step of the way. We can recommend the best facilities for our clients because we have spent time learning about these facilities and personally visiting the senior living facilities in our territories. In most cases, the places we recommend are facilities where we've actually placed seniors and have firsthand information about the care services solicited from feedback from the families. Our services are free to families and seniors as we are compensated by our referral network of providers. CarePatrol has 7 franchisees covering the greater Washington, D.C., Baltimore corridor, including Northern Virginia. We are eager and well prepared to help guide families to the best senior housing options for their loved ones. To date, CarePatrol in Maryland, Northern Virginia has worked with over 1,000 senior care facilities, and we have placed well over 3,000 clients. We are committed to serving seniors in our communities. So let me return you to Steve, where he will have my CarePatrol colleagues introduce themselves to you. And again, welcome to our presentation.
Great. Thank you, Charles. And I did copy the contact information for everybody into chat, but let's go around and get to meet some of these folks and find out what regions they serve. So I'm going to start with you, Paula. You're on my left, and I'll go around that direction today. Paula.
Hi, welcome to this wonderful event. I'm Paula Sotier. I cover most of Baltimore County, all of Baltimore City, and Harford County.
Great. And below Paula, I've got Cindy Evans.
Hi, good afternoon, everybody. I'm Cindy Yar Evans, and I cover part of Baltimore County and Anne Arundel County.
Excellent. And then below Cindy, I've got Bonnie Elliott in her car.
Hi, everyone. Good afternoon. Welcome to our event. I am Bonnie Elliott, and I serve Carroll, Frederick, and Washington counties in Maryland, and Loudoun County, Virginia, a little bit west, Berryville, maybe Front Royal. Thanks.
Great. Where are you parked right now?
In a neighborhood in Reston.
Oh, wow. Great.
Hopefully a quiet one.
And then we've got the next to Bonnie, the other Bonnie Danker.
Good afternoon. Nice to be with you. I'm Bonnie Danker, and myself and my team cover the Howard and Montgomery County areas of Maryland, and we also go into the district.
Great. And then above Bonnie, I've got Robin Edwards.
Good afternoon, everyone. I'm Robin Edwards. I cover Northern Virginia, Fairfax, Arlington, part of Loudoun, and part of Prince William County.
Okay. And then last but not least, we've got Amy Fager. Whoops. Oh, here, unmute Amy. There you go.
Welcome, everyone. I'm Amy Fager, and I'm in Delaware and also Maryland Eastern Shore.
Excellent. And before the Care Patrol team leaves the screen, I know I need to welcome a very important person to today's event, and that's Gail Huberman with Market Pro Home Buyers. You can see I put her logo and contact up on the screen. Each month, Care Patrol works with a vendor to co-sponsor the event, but more importantly, to share some additional resources that are out there in the community. And so let me see if I can get Gail up on the screen here. Oh, she is. I got so many pictures on the screen. So Gail, welcome and thank you for supporting this event. Tell us a little bit about Market Pro Home Buyers.
Thank you, Steve. It's my pleasure to be here. Market Pro Home Buyers has been in business since 2012. And basically, we offer seniors an alternative home selling option when they have a difficult property to sell or they're overwhelmed by the process of getting their property ready for the market and to be put on the MLS by a realtor. What we'll do is we will buy the property as is for cash, and we're able to close on the homeowner's timeline. So there's no inspections on the property, no need to do any renovations, no need to clean up the property for showings, no need to clean out the property in any way. We tell the clients to take what's important to them and leave the rest for us. We also cover all closing costs in the process and will help with packing, moving, and pay for packing, moving, and like I said, take care of the final clean out of the property. I mentioned the flexible closing dates. This is especially beneficial for seniors because they have different situations. One might be a situation has occurred where they immediately need to go into assisted living. We are able to close in as quick as 7 to 10 days. And if they need, we can cover the deposit at the assisted living facility. I think people have sometimes heard about bridge loans that they have to take to enable them to renovate and have money to go into these communities. This would eliminate the need for that. There's other situations where a senior may be waitlisted at a community. We can basically have everything in place. So as soon as they get the call from the community, we can close within a few days of that, or literally a day after they move into the community, we can be ready to close. I've actually worked with Care Patrol in several instances where they've brought us in to help their client. It's been a pleasure to work with the entire group. I think it's nice to see their seniors transition smoothly and without hassle. So I will put my information up on the chat room. And I mentioned to Steve, I am going to try to put up a testimonial there. We recently did some work with Paula and Chris up in the Baltimore area. And it kind of highlights why we were brought in and how we were able to work together with a difficult situation. So I'm hoping my best that I can get this testimonial up there.
Yeah, and if not, we can email it to everybody after the event. But also very important, Gail has a door prize. And so at the end of the event, we'll bring Gail on for the spinning of the wheel, which is always popular. And you may win an instant prize there. So, okay. So, well, thank you, Gail. Thank you to the Care Patrol team. And as you guys leave the screen, I just want to give a shout out for before Jason pops on. I want to, with this month's presentation, I want to just give a shout out for next month where Care Patrol has put together a panel on Parkinson's and probably broadly movement disorders in general, which is a great topic that affects many older adults. But today we're thrilled to have Jason Hafer, the Executive Director of HomeCentris Home Healthcare, sort of uncovering the mystery of home care. And Jason, thanks for being a part of this. And tell us a little bit about yourself and what got you into this business, and we're looking forward to your presentation. And just a reminder for folks that we want to make this interactive. So if you've got questions related to home care, personal care, private duty, what have you, make sure you type them in, and and Jason will address these. But Jason, tell us a little bit about yourself.
Sure. Thanks, Steve. And I want to start off by thanking the CarePatrol team for the invitation. It was just a few months ago. We were lucky to be a sponsor of one of these events, and really enjoyed that opportunity. And in working with Amy and Bonnie and Cindy and many of the other folks with the CarePatrol franchises across the state, we were lucky to be asked to come back and talk a little bit more about what we do at HomeCentris. So I've been with HomeCentris about 5 years. I lead our personal care division, and that may not mean a lot until we get to talking a little bit more about personal care and what it is, but I'll explain that when we get there. Prior to coming to HomeCentris, I've been with some national home care providers and worked in both long-term care facilities, assisted living, skilled nursing facilities, and hospital settings. I have a passion for aging in place, for allowing seniors and individuals with disabilities to find the environment where they're most comfortable, whether that's an assisted living community or a home environment, and then really being able to layer in the services that allow them to thrive and maintain their independence. That's really what brought me to HomeCentris, and has brought me to the discussion today about the different services that are available to individuals in their homes. So let me go ahead and share my presentation and
Great.
Rolling.
And that's great, Jason. And I'm going to drop behind the curtain here, and then if it's okay with you, if questions do come in related to something you're talking about, I may jump in and read those to you. But definitely take it away. And then one other little technical thing that I noticed is just be careful. It seems like you might be moving your arms around a little bit, and it's getting picked up on the mic. So just try to pay attention to that, if you don't mind.
You got it. No problem.
All right.
I tend to talk with my hands a little bit. So
oh, I do the same thing. I just wanted to let you know that we're getting some of that feedback.
Gotcha. No problem. Well, yes, thank you. So I think we've already done the introductions. My name is Jason. I'm the executive director here at HomeCentris. Today, my hopes are to give you just just enough information to really understand the differences in the levels of home care, the types of home care that are available. Talk a little bit about the types of providers that provide the different levels of in-home care. Talk a little bit about payers and how the different levels of care can be provided or paid for, and then ultimately just give you a few tips or pointers or questions that you can ask as you're trying to select a provider in the community to really help you be able to narrow down the search, narrow down the focus as you're identifying the right provider for you. There's no way that we can cover each and every piece of this today. We're gonna touch on some things. My hopes are to give you just enough information to allow you to ask some really good questions if you're ever in a situation where you're trying to identify the right type of in-home care for you. So at HomeCentris and really in home care, this is what it can feel like a lot of times as you're out there trying to figure out where to go next, or what does this mean? And I'm getting ready to discharge from a hospital setting, or mom or dad needs additional help in the home, or I need additional help in the home. There's just so many questions that you're faced with that I hope I'm going to be able to help you clear up some of the confusion today. So let's start off by talking about the different types of in-home care that are available. One of the most common types of in-home care is what's called home health care. Home health care is sometimes referred to as Medicare certified care, skilled nursing care, skilled care in the home. Those types of terminologies all reference back to home health care. We also have personal care, and that's the division I lead here at HomeCentris, where we are oftentimes called private duty or non-medical aid services, in-home assistance services, lots of different terminology or nomenclature that really is referencing this personal care service line. And then the third service line that I want to talk a little bit about today and touch on is hospice care, often referred to as end-of-life care or palliative care. And palliative care and hospice are a little bit different, but they're oftentimes interchangeable terms. So really, to understand each one of these, let's take a deeper dive into them. So home health care. Start off with the goal. The goal of home health care is to provide some short-term interventions, usually skilled interventions and care that are going to help the patient to return to a baseline or achieve maximum independence. Well, what does that mean? That means that something has occurred to me, whether it's a surgery, whether it's a flare-up of some sort of an acute illness, whether it's some sort of decline that's occurred to me over time. And really the goal of a home health intervention is to help me get back to where I was before this situation occurred, before the surgery, before the fall, before the illness. It's physician-directed care that's designed to assist in recovering or management of the illness. Common examples would be wound care, IV medication administration, injections, therapy services. That could be physical therapy, speech therapy, occupational therapy. It could be management of a serious illness or unstable health status, something like diabetic management, diabetes management. Sometimes there's new diagnoses and skilled care can come in for a period of time to assist the individual in managing that. And it could also be family and caregiver education and training. And with a new diagnosis or a new illness or a flare-up of an illness, oftentimes if we can learn to manage our environment and learn to manage our diet and our activity and our medication regime, we're able to keep the illness from impacting our daily life. And that's where this family and caregiver education and training can come into play. Home health care is commonly delivered by skilled providers, licensed providers, folks like registered nurses, licensed practical nurses, therapists that we talked about. Medical social work, oftentimes overlooked, but a big key component to home health care is having a social worker who can help to manage all the other things that impact our health. Registered dietitians, home health aides or certified nursing assistants. And all of this care is going to be overseen, ordered by a medical practitioner, a physician, a nurse practitioner, someone along those lines who's going to order the care, ultimately approve the plans of care, monitor the care, and direct the care that these skilled clinicians are going to provide for us. Home health care typically is a short-term or what's called an episodic level of care. Episodic means that there's a defined period of time. Usually in home health care, it's 30 to 60 days. It requires periodic recertifications in order for the care to continue over time. And you have to meet some criteria. For example, you have to meet homebound status criteria. You have to have a skilled need. You have to have a prognosis of continued improvement in order for home health care to continue. It can be delivered over longer durations of time for individuals with chronic complications, but that is not the common delivery of skilled home health care. It is occasionally something that can happen, but most commonly, these are going to be short-term bursts of care to get you back to baseline. Home health care is oftentimes or usually paid for by, the most common payer is Medicare, can also be paid for by Medicaid. It can be paid for by commercial insurance plans like Blue Cross Blue Shield, Aetna, Cigna Health Springs, managed Medicaid programs, managed Medicare programs, could be covered by workers' compensation as well. And picking the right agency for home health care is a very unique challenge that we have. The first thing I would say is there's something called the Medicare Star Ratings. It's the website's here. It's medicare.gov/CareCompare. You can select agencies that provide service in the area, the geography where you live, and you can compare agencies around patient satisfaction and outcomes metrics. And there's star ratings that go along with this, very similar to skilled nursing facilities where they have star ratings. The Home Health Compare allows for star ratings as well. And so you want to look for agencies that have specialty programs that align with your condition. For example, if I've recently had cardiac surgery or I've recently been diagnosed with COPD, many home health agencies will have programs specific to the care of that ailment, of that disease, of that illness. And so you want to look for programs that specialize in the care you need. It's always important to ask what their experience is with the level of care that you're needing and you're requiring. We want to talk about staff availability. So if I have a diagnosis that's going to require the intervention of a speech therapist at some point in my care, I want to make sure that a speech therapist is going to be available with the agency that I select to provide care. Same thing with medical social work, dietitians. We always want to make sure that staff is available and that they're going to be able to start care in a timely fashion. Most often, home health care, skilled care is ordered post some level of acute stay. So post hospitalization, post skilled nursing facility stay. And the idea here would be for you to transition from a hospital or a skilled nursing home back to home with the support you need, starting up and picking up immediately, so that there's not a big lag in service or gap in service. So asking how long it will take for a start of care to happen is important to remember, because you want to make sure that that's going to start timely. In this COVID world that we're living in, on the home health and home care side of things, staffing challenges have been something that we're all facing. So there has been an occasion in certain markets, in certain areas, and with certain agencies, a bit of a delay in start of care. So it's important to ask, if I go home today or if I go home next week, how quickly will the agency be able to start my care at home? If you're working with your primary care physician or a specialist, maybe you have a new diagnosis of COPD and you're working with a pulmonologist, you want to ask that specialist or ask your primary care physician, who do they work with? Who do they recommend? What agencies have done a good job with their patients in the past? And it's always important, although I put it last on the list because you really want to make sure the care is right, but we have to make sure that the insurance that we have is accepted by the provider. It is highly uncommon in skilled care for this to be a private pay situation. This is almost always paid for or funded through Medicare benefits or through an insurance benefit. The costs associated with these skilled practitioners usually exceeds what folks or individuals would pay privately. So this is almost always going to be an insurance type of a payment situation. So we want to make sure that we're working with a vendor, with a provider, a skilled provider that accepts the insurance that we have. I guess I could pause for a second here and see if there's any questions about home health before we move to another level of service.
I don't. Oh, okay. Well, actually, let me read you this one that just came in from Robin Hall, and whether or not it's addressed, it just popped in, but you may address it later. But it says,
Sure.
Many of my elderly clients are sent home or released from the hospital without proper preparation for in-home care. No post-hospital case management, that have most of them return to the hospital due to falls, recurring illness. Quite a few have Medicaid that may not cover the in-home expenses. Is there a process to be done that patients are prepared for prior to release? So I apologize for reading that not the greatest way, but I think addressing sort of the common challenge of being in the hospital and now preferring to be discharged to home.
Yeah, I think that's definitely a big challenge. We will see when we talk about the personal care services that I'll talk about next, that there are some opportunities for Medicaid to intervene and provide some long-term support services in the home. And as I said, we'll talk more about that. But I think the message is to be preparing from the moment that the illness strikes. Really to be working closely with the hospital discharge planner or case management team to understand what resources are available. One of the things that we've noticed here at HomeCentris in the past probably 12 to 18 months is that many of our hospital partners have started to implement some transitional case management or transitional care networks, where they will allow for or pay for someone to assist the patient in transitioning from home to back to baseline, or from hospital back to home and to baseline. So we have partnerships with many of the hospital systems throughout the state of Maryland, where they can contract and bring in a caregiver for a period of time to assist in transition, or they have a transitional case manager, someone who's able to follow that patient when they discharge home and check with them 24 hours out and 36 hours out and or 24, 48 and beyond, and really just ascertain, are things moving in the right direction? Did we make our follow-up appointments? Did we obtain the medications that we were discharged with? So I would say that that is a very common challenge that individuals face, but I feel like the hospital systems are starting to address that. So I would ask about transitional care. Is there any sort of transitional case management that can follow, especially with new diagnoses like COPD, diabetes, cardiac issues? There's oftentimes a transitional program that might allow for a few days or a few weeks of support from post-hospitalization to allow the person to adapt to back to their home environment. So yeah, that's a great question. And I think it's all about starting the planning process for going home the moment you kind of go through the door. And I know that's hard to do, but having that conversation with that discharge planner early on to make sure that that we have as much time as possible to get services in place, whether that's a personal care agency like HomeCentris, or whether that's somebody else. I think that's important to start that conversation early. Great question.
Okay.
Thank you.
Great. Okay. Well, I'll jump in if any more come in.
That's
So
great.
just as a reminder, folks, you can definitely ask questions.
All right, so I touched on personal care, and really this is my wheelhouse where I live here at HomeCentris. The idea, the goal of personal care is to provide supportive services to assist the client in maximizing quality of life, maintaining independence, and aging in place. The reason I'm passionate about this, and the reason that the CarePatrol team is so great at what they do and passionate about what they do, is this is all about quality of life. This is all about maximizing independence. Aging in place could be at home, it could be in an assisted living community, it could be wherever the senior resides. And those of us who work in this industry, we're passionate about helping people to maximize quality of life and maintain independence. So personal care is special to me. What it is assistance with activities of daily living, commonly called ADLs, or independent activities of daily living, commonly called IADLs in the home. ADLs are things like personal hygiene, bathing, dressing, grooming, meal prep, mobility, incontinence, medication assistance, those types of things. IADLs are more of those secondary things that have to happen in order for us to be independent and stay safe at home, but they can oftentimes be done by someone else or with the assistance of someone else. They're not necessarily as daily of a task or as sometimes as important. Meal preparation, for example. Housework, transportation, errands, assistance with communication, assistance with paying bill, extracurricular activities, companionship, things like that. These are all things that are important to quality of life, and really important to have assistance with, but not necessarily at the same level as medications and incontinence care and things like that. So personal care is able to provide that full gamut of, you'll oftentimes hear it described as personal care and homemaking services, and that's oftentimes what we do. Who delivers it? Personal care is commonly going to be delivered by a caregiver. In some situations, in some circumstances, that may be a family member. So there's this idea that there's a lot of unpaid providers out there. There's family members who provide caregiving services, but under some of the Medicaid waiver programs, a family member may actually be a paid provider for care. There's also sometimes called direct care workers or direct service providers, personal care aides. These are all really the same general level of individual who's providing hands-on personal care services. You could have certified nursing assistants, certified medication technicians. In most circumstances, these individuals, their care is going to be coordinated or supervised by a registered nurse. There's different levels of licensing for agencies in Maryland, but most of those agencies are overseen by registered nurses. And usually these services do not require any sort of physician orders or medical practitioner orders. These are going to be those daily personal care services, not skilled services like we talked about earlier. So how long does personal care last? Usually it's long-term. Under the Maryland Department of Health, they call this an LTSS, a long-term support service. These services can range in anywhere in time from a short-term transitional event to years of service. We have clients with our agency that have been with us 15 plus years with receiving personal care services. Again, as I mentioned, it could be a short-term transitional support that would typically happen. As the person who asked the question earlier mentioned, sometimes folks come home from hospital, don't have everything in place. Sometimes personal care can come in and assist with a transitional period to get that person set up and organized and ready to be independent. That might be an example of the short-term side of personal care, but most commonly, these are our ongoing long-term services. Sometimes there are respite services provided to provide relief to a family member. So if, for example, I was caring for my grandmother every day and I needed a vacation or a break, perhaps a local agency like the county or somebody along those lines may have respite programs or grants available where a caregiver could come in and provide relief so that I can step back for a moment and perform some self-care and take care of myself. Before I step back into my daily role as that family caregiver. Personal care services are paid through a variety of ways. And really at HomeCentris, this is one of the things we spend a lot of time on is how can we assist somebody in making sure that they get all the care they need and that it's funded appropriately. Throughout the industry, the most common way personal care is paid for is via private pay or personal funds. However, there is a large and growing segment of the population that is funded through Medicaid programs. In Maryland, they're called the Community First Choice waivers. And these waivers offer personal care services in the home for individuals who can't otherwise afford the services. You could have your care paid for or funded through a long-term care insurance that either you have from an employer or that you purchased yourself. Perhaps if you or your spouse was a veteran, you could qualify for benefits through the Veterans Administration or through a program called Aid in Attendance, which also coincidentally can pay for care in assisted living communities as well. And it's a pension benefit that is sometimes available to veterans or their spouses. There's a lot of state funded programs like respite programs and county senior care programs that take state dollars and administer them in a way in order to provide services to individuals who maybe don't quite have enough funds to pay privately or aren't able or eligible for some of the other programs that are available. And then there's other community funding sources. This could be an example where maybe the hospital is going to pay for transitional support. We work with some insurance companies that have some programs, specialty programs where they'll pay for transitional care. We also work with agencies like Jewish Community Services and Jewish Social Services agencies where they administer community funding for personal care programs for individuals who qualify under their direction and their criteria, but qualify for personal care services. So there's really a lot of ways that personal care can be paid for. And so, I wanted to make sure that I spent some time talking about those. Really, that in and of itself could be its own presentation. So, we just want to touch on them and let you know that those sources are available. And if you have questions, let us know.
Hey, Jason, just to kind of jump in, I wanted to, in chat, last month, our discussion was actually on the Veterans Aid and Attendance Program. Yep. So I copied a recording of that into chat. Awesome. And we do have a couple of questions that are, we actually have one that just came in from Abigail that said on cost, because that came up. It says, I've heard there are long waiting lists to get PCA services in Maryland through Medicaid. Is this still the case? And what do you suggest for that situation?
Certainly. So the short answer is that there are multiple Medicaid programs that are funded through the state that can pay for personal care services in the home. Some of them do have long waiting lists. There's a program called Community Options. It's one of the waivers, one of the more commonly known waivers, and it does have a waiting list that oftentimes lasts years. However, the Community First Choice waiver, the Community Personal Assistance Services waiver, these two waiver programs do not have a waiting list, but do have a process. And so the process takes about 3 to 6 months, and there is no waiting list, as I said, but it's just a matter of going through the process of first off applying for Medicaid, qualifying for Medicaid, and then ultimately applying for the waiver program, qualifying for the waiver program, and having a plan of service approved by the state. What I suggest is that, and I'm sure most of my colleagues in the senior care industry would say the same thing, don't wait until you need the services to start planning for them. That's a challenge. The cost for personal care to pay out of pocket, the state average in Maryland is somewhere in that $25 per hour range. You'll find some agencies less, some agencies more, it really depends. And you know, it is expensive. Now, there are other programs that are oftentimes county funded programs through the Department of Social Services that may offer a shorter window of qualification. They oftentimes don't offer as robust of a benefit plan. But what we do when we identify someone who needs the services and needs them quickly is we try to kind of leave no stone left unturned in trying to find resources for that individual to become eligible or to receive the services that they need. Whether that's working with the counties, working with the Veterans Administration, or working through the Medicaid process and providing some sort of scaled down or slimmed down services while they're qualifying. We've worked through all of those things in the past. And I think most personal care agencies will do that with you, work with you in order to qualify. So I guess it depends on the program you're applying for, how long of a wait or a process delay there may be for you. But typically for Medicaid, we see about 3 to 6 months on most of those waivers.
Let's see. And Sharon, I knew that once we brought up Medicare, Medicaid cost, it was going to open a can of worms, but I shouldn't say a can of worms, some great questions.
Yeah, absolutely.
But Sharon asks, why are they called Medicare, Medicaid waivers? Like, she was curious, I think, more about the waiver terminology.
Waiver terminology, yeah. And you know, that's a good question. I believe it comes through some federal legislation that gave the states a waiver to provide alternative care delivery methods and provide more home-based care and less facility-based care in the long run. So in the past, Medicaid dollars were allocated to the states really to, and then individuals who were on Medicaid, their option was they went into a facility, they went into long-term care in a nursing home. Years ago, many years ago, the federal government started to set aside and carve out funding for the states and provide waivers to the states to be able to, for the states to make people eligible to receive more in-home based services and home-based care. So I think that's where the term waiver comes from. It's actually from the federal legislation that allocated these dollars years ago, and it just kind of stuck.
Okay, great. And then I want to make sure I just throw in Keisha's question that she posed a little bit earlier in the discussion is, what about people with disabilities or visual impairment? Is there, you know, are there programs for those folks? I guess, okay, so like, I think she's talking about maybe younger people that have disabilities or people who are visually impaired.
Yeah.
Any programs?
Certainly. So there absolutely are. The waiver programs that exist, although most commonly applied to seniors, do not all require that the individual be 60 plus or 65 plus in age. We actually serve individuals from 18 years on up under the waiver programs. So in order to qualify for the Medicaid waiver programs, for some of them, You just have to have the needs. So if a nurse evaluator determines that the need exists and that this individual has a likelihood of moving to an institutional setting if they don't get the support, they can qualify. So again, we have individuals ranging from 18 on up that are covered under the waiver services within our agency. So absolutely, those programs can be applied to younger individuals with disabilities. There's also some programs that are in a totally separate vein for individuals with developmental disabilities, and that's really not my expertise, but there is a whole other segment of the Medicaid programs and state programs that are geared towards individuals with developmental disabilities. As for visually impaired, we find that there are some community resources that sometimes offer some respite or transitional services for individuals with visual impairment. But visual impairment could also qualify you for the waiver programs, the Medicaid waiver programs, because if you can't, for example, if you can't see your medication to take your medication appropriately, you run a risk of hospitalization or institutionalization. And so therefore, by providing a certified medication technician, excuse me, in the home to assist with that medication administration, the state eliminates that risk or reduces the risk that there will be an institutionalized stay in the future. And so they will oftentimes fund that care as well.
Great. Okay, let's see. We've got, you okay if I just do a couple more of these and then we'll get you back on track?
Yeah.
Okay, great. So, well, first off, Pamela Mills has a great comment that she shared, and I dropped it in chat.
Awesome.
So I want to make sure everybody reads that, but I'll circle back to that a little bit in a little bit here. But Sharon also says, and this is, I think it's a mystery to a lot of us, is how do you plan ahead when you're told not to apply unless there is no money in your account? And I'm assuming she's referring to Medicaid.
Medicaid, yeah, and that is, yes, that is a great point. You know, you can't qualify for Medicaid until you meet the financial eligibility. Oftentimes, what we identify though is that individuals, even if they have Medicaid in place, they wait until a crisis in order to start looking for services. They wait until their health has deteriorated to a point that institutionalization is imminent, and then they'll reach out for help. That's kind of what I'm trying to avoid when I mention doing some planning or planning ahead. It is difficult with under the Medicaid side of things to plan ahead for financial situations, but there is something in the state called a spend down. So if you plan ahead and select an agency that works both with private pay and Medicaid, one of the things that I think I talk about here when I talk about picking the right personal care agency, there are agencies that are private pay specific, there are agencies that are Medicaid specific, and there's agencies that work across the genres of payers. If you know that your resources are limited and you won't be able to pay privately indefinitely for services, my recommendation is look for an agency that's going to be able to help you make the transition. If you have a limited amount of resources and you can pay for 3 months or 6 months of care, and then you're going to need to transition to Medicaid, work with an agency that can help you do that. And that is going to be able to allow for continuity of care as you move from one payer to another. That's important. I think it's always difficult to have to transition agencies once you become used to processes and caregivers and staff, and you're comfortable. To have to move is difficult. So I think making sure that you select an agency that's going to be able to move with you and has some level of expertise with personal care on the Medicaid side and the private side is important. And I think those are some of the ways that you can plan ahead. I think also, you know, making sure that your family, you understand what family resources are available. We've worked with folks in the past who they call us out of desperation because they assumed or felt like family was going to be able to be a support system for them. And when things happened, then all of a sudden that support system dried up and they didn't have that resource. And then again, understanding and knowing within your county or your local jurisdiction what resources may be available for you to bridge the gap when it comes to applying for Medicaid. So for example, in many counties, there's what's called senior care programs or personal care programs that the County Department of Social Services will administer. And they use these programs as a gap or a bridge for individuals who need to apply for Medicaid in order to get services in place. So knowing and understanding what programs are available for you locally is another way that you can start to plan ahead for services that you're going to need in the future.
Great. Okay, let's see. Tawanda Young says, a lot of the patients I serve have Medicare only.
Mhm.
I've been unable to find personal care for them. Everyone says they will have to pay out of pocket with Medicare only.
Yeah. So Medicare rarely pays for personal care services. There are some new Medicare Advantage plans that have so far they've been a pretty slimmed down personal care benefit. When I say slimmed down, they may offer 80 hours annually of care, or they may offer up to 4 hours a week or 10 hours a week of care. So very minimal benefits on the personal care side of things. So up until now, really, if you've had Medicare, there hasn't been those options for you. So that's where, if an individual comes to us with Medicare only, we will assist them in making the referral into the Medicaid process. That unfortunately takes some time, but in the meantime, looking at things like, are they a veteran? Could they qualify for aid and attendance? Do they qualify for any sort of respite or senior care program in the jurisdiction they're in? Is there any sort of long-term care insurance that may be floating out there? Those types of things. Really just working with an agency that's willing to dig in and look for those opportunities is going to be important in those situations. Oftentimes, or sometimes there really isn't an alternative, but oftentimes we're able to unearth something or identify something that's able to help.
Okay, great. And then, I can't pronounce her name. Oluwasi, I believe, says, how long does it usually take to get approved for the Medicaid waiver?
Yeah.
Do you have any idea on that?
Yeah, we're seeing times currently in definitely at minimum 3 months, but 6 months, sometimes a little longer, is what we're seeing currently in this COVID world. Pre-COVID, it was more like in the 8 to 12 weeks range was the common approval timeframe. We're telling folks and individuals now to plan for more like 12 to 16 or even 12 to 24 weeks, something like that, for the programs to make it through the approval process. Unfortunately, with the changing care environment and you just kind of all of the things that are impacting even our partners in adult medical day programs, which are closed, and all of those types of things, the massive influx of individuals who are skipping skilled nursing facilities to come home with care, all of that has led to a lot of pressure on the system, and it has led to some delays. So we're telling people to plan for at minimum 3 months, but really more realistically 4 to 6 months for the process to be approved.
Great. Let's see. Okay, and I think we can get you back on track there.
Yeah.
Sharon did say, how can we access a recording of this? We will post that after this event, so there'll be a recording that you can share. Oh, of course, here comes whenever I say something like that, another question comes in. So Angela says, if someone was offered Medicaid through receiving SSDI, but declined it because of having private insurance, should the person think about reapplying if they are now having additional health issues involving a longer hospital stay or multiple stays?
Yeah, I'm not specifically familiar with how that would impact their private insurance. I would caution them to make sure that they fully investigated how having a Medicaid program would impact their private insurance, or vice versa, how the private insurance may impact their Medicaid program. But I would say if you are eligible for the Medicaid programs and you anticipate that need in the future, for personal care in the home or support services in the home, and you anticipate needing to access Medicaid, then absolutely, I would suggest a conversation with the Department of Social Services in the county or jurisdiction where they live in order for them to really understand how the two would work together. If private insurance is still in play, I'm not sure how the Medicaid products or programs would work together with that private insurance, or if one might potentially impact the other in any way. I don't believe so, but I'm not really an expert on that. So I would suggest that they reevaluate and have another conversation with the Department of Social Services to say, this is what I'm looking at, this is what I'm thinking about, and does it make sense for me to reapply?
Great advice. All right, let's get you back on track
Sure.
there. Oh,
So-
holy cow, and we're almost at the top of the hour, but keep on going, and if any other questions come in, I'll jump in.
Sounds good. And I can make this pretty quick from here on out. So picking the right personal care agency, I think we touched a lot on this, but there's a couple of other things to think about. In the personal care world, there's agencies that operate with employees and agencies that operate with subcontractors or independent contractors. You want to make sure that you select the right agency for you. You want to make sure that you select an agency where staff are background checked, insured. You want to ask some of those most basic questions. It sounds like in this day and age, you feel like you shouldn't have to ask that question, but the reality of it is you do, and you want to make sure that you kind of cross all your T's and dot all your I's. Look for agencies, again, that have specialty programs that align with your needs, whether it's dementia care specific or veterans programs, whatever aligns with your needs. And I talked earlier about transitioning from private pay to Medicaid, making sure you work with an agency that specializes in those two programs and is able to help you there. You want to, again, talk about staff availability and the ability to send replacement staff if a caregiver calls out or is ill or isn't able to make it to work one day. How does that process work, and what type of a fill rate does the agency have on those call outs? You want to make sure that if it's important to you, and I think it should be, that you ask if you can interview staff before they're assigned to you. Unlike the skilled world where nurses are assigned and you'll get the nurse that is covering your area and assigned in your area, on the personal care side of things, you oftentimes have an opportunity to interview a couple of caregivers and make sure that they're a good fit for you, that personalities align, and that you feel comfortable with their care style. So always ask if you have an opportunity to do that before they're assigned. Again, ask how long it's going to take to start care, and ask your friends and family and neighbors if they've ever had any experience with any home care companies locally or personal care companies locally, and what their thoughts are. Customer satisfaction data. Many agencies use third-party customer satisfaction surveyors to really understand the quality of care that they're offering and how people are responding to their care, and ask if you can see that data. And ask for a reference, either from a current or former client or family. We have here at HomeCentris, and I think it was mentioned earlier by the sponsor that testimonials exist. And there's lots of people who can provide testimonial about the care that they've provided to others in the past. So those are some things to think about when you're picking the right agency. The last type of service or home care that I wanted to talk a little bit about is hospice care. And hospice really is very different than home health and personal care, although there are some areas where things overlap. Hospice care really has a goal to provide quality of life to individuals diagnosed with terminal illness when there's really no prognosis of curative treatment, when there's no longer this idea that this individual is going to recover or get better, or maybe they just no longer desire to seek the treatments that are going to allow them to recover or get better. And so hospice is really oftentimes called, as I said before, end-of-life care. It's this combination of both skilled and non-medical services that are designed to support people during end of life. Could be provided in home, or it could be provided in a facility-based level of care, an inpatient unit. It can be provided in an assisted living or a skilled nursing facility. The skilled services are going to be things like pain management, medication management, any type of symptom management to provide comfort and quality of life. And then on the non-medical side of things, this is going to be perhaps personal care, counseling, music therapy, chaplain services, family support, all of those types of of non-medical support services that really help a patient and their family cope with this end-of-life care. It's delivered most often by hospice aides, which are usually certified nursing assistants, nurses, RNs, LPNs, hospice physicians and nurse practitioners, social workers, chaplains, music therapists, grief counselors. All of those types of individuals have a hand in helping to deliver hospice care. And hospice care doesn't really have a set time or criteria. It can last for days, it can last for months. You do have to meet the criteria to continue to qualify, but there's really no episode prescribed. It's something that can be ongoing as long as the need exists. You do have to have physician certification, and it's oftentimes most commonly paid for by Medicare or commercial insurance, although there is some Medicaid managed care organizations that have some level of hospice benefit available, not nearly as common as Medicare or commercial insurance. And not typically workers' compensation, although it can occasionally, depending on the nature of the terminal diagnosis, be a workers' compensation coverage. Picking the right hospice agency, again, look for specialty programs. Whatever your terminal diagnosis is, or the terminal diagnosis of your family member is, look for an agency that specializes in that level of care. Find out about their ability to staff and have replacement. Ask again if you could interview staff. How long will it take to start care? Seek recommendations. And then really understand the different levels of hospice care that are available, whether they're inpatient or in-home or 24-hour continuous care, and understand what needs you may have in the future. And you know, if you think that an inpatient level of hospice care in the future may be what you desire, then make sure you select a provider that offers that level. So I think, again, hospice is its own category, its own service line in and of itself. But I just wanted to touch on it because it oftentimes is provided in conjunction with the other services. But I think that takes me to the end of my prepared presentation. And again, happy to answer any questions that have popped up, Steve, or turn it back over if everybody's good.
Actually, this is a great one. Where does an end-of-life doula fit into home care? And that's shoot, that might be a great future discussion topic.
Agree. Yeah. So I would say an end-of-life doula is definitely, whenever there's a terminal diagnosis, whether hospice has been selected or not, I believe an end-of-life doula should be engaged. That is, I will admit that it's probably only been about the last 2 years or so that I've become familiar with that role and that person, that practitioner. So my level of expertise is a little more on the novice side. I would say I would agree that it's probably an excellent speaker in the future. But I would say, and the recommendations from the doulas that I've met in the past are, as soon as that terminal diagnosis is given, they're there and they're ready to start helping in the transition and help planning for what's coming. And so I would say engage them as soon as the diagnosis comes across.
Yeah, no, that's great. And I'm glad whoever asked that question, just bringing that profession to the forefront. I think most of us are familiar with doulas at the beginning of life, but the fact that there is this new and growing profession at the end of life is wonderful. So, well, you know, this has been great because we answered so many questions in the middle of our program. The timing is perfect because it's actually the top of the hour here. And Jason, I dropped your email into the chat, but now I think we are moving towards.
You want me to stop
popular spinning of the wheel of names here. Let me pull that up, and if Gail wants to jump on the screen here, Gail. Again, thank you to Market Pro for sponsoring the CarePatrol education series, and I understand you've got a door prize for those that registered. What is this? What is
it's a $50 Amazon
gift card that will be emailed to the winner.
Okay, great. Well, if you want to virtually spin the wheel by raising your hand.
There you go.
Okay. And let's see who the lucky winner is. It's Karen Benjamin. So I will make sure that you get Karen's email there. I'm going to cut and paste that just so that we.
Congrats to Karen.
Karen. Yeah, Karen. Well, it probably is Karen. I just pronounced it kind of wacky. But anyways, well, thank you to you, Gail. Thanks to the whole CarePatrol team. Thanks to Jason. What a great discussion. We probably could have gone a half hour longer, but we know everybody's got to get to their next Zoom meeting. So I will share this recording and we will see everybody next month for the discussion on Parkinson's. And all right, well, I'm gonna, Paula, you any closing words as a CarePatrol?
Mute.
Oh, shoot. Did I just mute you again?
No. So well done. We did lots of good information that I think everyone will use going forward. And Gail, it's always great working with you.
Thank you. Likewise.
All right. Okay, Bonnie, and we got Bonnie there in Reston. So, okay, we will see everybody next month and I'll get this recording out.
Thanks.
Take
you all.
care. Bye.